Hello, everyone, and welcome to today's webinar hosted by Clinic Boost in partnership with Mitochondrial, entitled The Mitochondrial Code to Cardiometabolic Syndrome, Optimizing Clinical Outcomes for Heart Disease, Diabetes, and Dementia. Before we get started, I would like to go over a few items so that you know how to participate in today's event. You have joined the presentation listening using your computer's speaker system by default. You will have the opportunity to submit text questions to today's presenter by typing your questions into the questions pane of the control panel. You may send your questions at any time during the presentation. We will collect these and address them throughout the presentation and during the Q&A session at the end of the day. Today's webinar is being recorded, and you will receive a follow-up email within 24 to 48 hours with a link to view the recording. This webinar is for educational purposes only and should not be considered medical advice. Clinic Boost, in partnership with Mitochondrial, are not responsible for individual decisions or actions taken based on this webinar. For personalized guidance, consult a healthcare professional. Our presenter today is Dr. Mark Menolacino, and he is a medical director at the Meno Clinic located in Wilson, Wyoming. He has over 35 years of healthcare experience and has completed medical school at the University of Nebraska Medical Center and then completed internal medicine specialist training at Banner Health, Arizona. He is one of the few physicians who is board certified as an internal medicine specialist, board certified in holistic medicine, and board certified in advanced hormone management and anti-aging medicine. He additionally has a master's degree in pharmacology and immunology and was a doctoral candidate in the medical scientist program, assisting with clinical trials of new medications, as well as part of the heart disease reversal team with Dr. Dean Ornish. He is a former professional athlete with over 10 years of experience as a personal trainer and strength coach for the Husker Power program. I would now like to introduce Dr. Mark Menolacino. Dr. Mark.
Thank you, Colleen, and thank you to Clinic Boost and Mitochondrial for giving me an opportunity to share some ideas with you. We're all kind of science geeks at heart, right? But we're doing clinical medicine. And what I want to share with you over the next 45 minutes is everything that I've learned in 35 years of medicine and what works in my clinic. So we're going to talk science, we're going to talk health, we're going to talk nutrition, but I hope to give you some clinical pearls that you can use tomorrow while you're taking care of your patients. So a personalized medicine approach, is it holistic medicine? Is it integrative medicine? Is it functional medicine? Is it just medicine? For me, it doesn't matter whether you're an MD, a DO, a naturopath, a nurse practitioner, a chiropractor, a nutritionist, a personal trainer. We're all on the same team, and it's a healthcare team. I can't do it myself. I need all of you to help me. And it's really a combination of all of us working together. What ties heart health and dementia and diabetes all together? Well, it usually involves a caregiver. You can't do it by yourself. You have to do it in a partnership. As healthcare professionals, we need a partnership, but all of our patients need a partner as well. What do we know about dementia? Dementia affects the hippocampus of our brain. That's the horseshoe area on the side of the brain. What do we know about caregiver stress? Taking care of someone with dementia. It causes cortisol fluctuations that damages that same area. So taking care of someone with dementia can actually cause dementia from the cortisol damage to the hippocampus. So this idea of being a care team really extends into our clients, our patients, into their families, into our peers, all of our colleagues, and companies like Clinic Boost and Mitochondrial. It's all about mitochondria, right? And it's all about inflammation. If you can figure those two things out and deliver it in a personalized way, you will be successful. And I really encourage everybody, walk the walk and talk the talk. Be the role model that your clients are looking for. Eat healthy, be healthy, exercise. Try to have these great interpersonal relationships, social relationships. So we talk about what's the best diet. In my clinic, we don't do diets because the first three letters are die. We do personalized nutrition. So is it the Mediterranean diet? Well, that diet is different in Greece and France and Italy and other areas of the Mediterranean. And could it be that the key to the Mediterranean diet is that you're eating with people you care about in a group fashion, laughing, loving, sharing energy. As Michael Pollan, one of the best authors on nutrition, says, eat your food at a table, and sitting by yourself at your desk is not a table. So this entire concept of not just the medicine we do, but the social, family, friend, love situation that it's developed in is the key. What got me into medicine was Dean Ornish. What did he do 35 years ago? He showed a nutrition lifestyle model that worked better than a cardiac bypass. He came to Omaha, Nebraska, where I was in high school. He took 100 men, because of course the first studies are on men, that were scheduled for cardiac bypass surgery to have the veins in their legs removed and replumbed for the heart. He took those men and taught them how to eat right, how to exercise right, how to have love and social relationships. And guess what happened to that group? They've now done better after 35 years, less deaths, less heart attacks, less hospitalizations, less medications, higher quality of life. So he proved it so long ago. And a lot of those same principles are what we're all doing today. It all applies to this cardiac, diabetic, dementia paradigm that we're working on. And this is, if you can figure out these 7 keys, and you know them, right? It's optimizing nutrition. It's not a diet, it's a personalized nutrition. I'm a big fan of food sensitivity testing. It's easy to do. You can do it from a finger stick. There's great companies out there. It at least gives you access to give people information. We were taught in medical school to scare you into fear-based behavior. If you don't stop smoking, your lungs are going to look like this. If you don't stop eating, you're going to get overweight. What I think we should do is let's provide information to empower our patients with knowledge to help them make good, healthy changes based on their belief system, but help be the guide for them. Because of webinars like this, we're all sharing information. Your patients and clients are doing the same thing. They're going online. You've got Eric Huberman, Peter Attia, you've got all these great podcasts that are out there. And like me, we're all half right. You've got to help pick and choose the pieces that fit your practice model and your patient base and meet them where they are. Find a common ground that you can meet them. Balancing hormones. Hormones are tricky and they change, particularly with women at different stages of life. And it's not about giving everybody every hormone. But what was just published in the Internal Medicine Journal? Women in their postmenopausal years, age 55 to 70, had better cognitive outcomes when they took bioidentical hormones. So we know that the hormone balance is key. Inflammation, inflammation, inflammation. That really is the root of all evil. I think we're calling dementia type 3 diabetes because it's an insulin resistance, it's an inflammation of the brain. And I'm going to show you how to fix that. You start with the gut, but you have to do the right testing to follow where you're going. Fix the digestion. We talk about the 5 R's of remove, replace, restore, rebalance, rejuvenate of the digestive tract. These GI stool tests are very, very helpful. You look at the entire microbiome. How do you talk to your patients about digestion? Well, guess what? Half the cells in your body are not yours. There's 10 times more bacterial cells in your gut than there are human cells in the body. The DNA of your microbiome is far exceeding your own DNA. So the gut microbiome is the hottest thing in medicine. We talk about leaky gut, and what really is that? It's intestinal permeability in the GI world, but we call it leaky gut. And if you have leaky gut, you have inflammation. If you have inflammation, your hormones aren't working. You're not optimizing your nutrition. What about detoxification? If you haven't read any of the work by Joseph Pizzorno, the world expert in toxicity, go get his latest book. He was, I believe, the founder of Bastyr Naturopathic College. Detoxification is key. What's the liver do? Teach your clients. The liver has 2 phases. Phase 1 takes compounds and chemicals, turns them sideways so phase 2 can put water on them so you can get rid of them. No, it's not that easy, but that's a great way to describe it to people. We're going to cover boosting energy metabolism. You're going to see some amazing science studies that show you how you could increase power, biogenesis of mitochondria, reduce endothelial inflammation. And we're going to talk about Mito being the leader of that with the mitoquinol product. Calm the mind. We all forget about that, but the brain and the gut are related. The gut makes most of your serotonin. Approximately 90% of your serotonin comes from your gut. That's why you feel things in the pit of your stomach. That's why events are gut wrenching. But you've got to calm the mind to calm the fire of inflammation. Well, it's this easy, right? What do we do for diabetes? We don't talk about nutrition. The first thing you're supposed to do is go to metformin or one of the medications. So, we can look at the small intestine, liver, pancreas, body fat, muscle, and we have a drug to work at each area. Now, here's how I think about blood sugar problems. We see elevated blood sugar. Now, type 1 diabetes, those are the younger people that develop complete insulin impairment and don't produce insulin. That's a different person. Most diabetes in our world, and we're now seeing it in kids in developing countries, which is scary. But diabetes is a lifestyle program typically, and it's got to do with inflammation and obesity. But what we do is we start one medication that works for about a year, year and a half. Then you go on 2 medications, works for another year and a half. Then you go on 3 medications, then you end up on insulin. That's the medical model. Well, we can substitute a medication in each one of these areas for a natural supplement. We know chromium and vanadium work. We know alpha lipoic acid is clinically proven for diabetic neuropathy to reduce it. Everybody knows the benefit of omega-3 fatty acids. But when you're talking about omega-3s, this is where quality really comes in. If you are not looking at the supplements your clients are using, having them read the other ingredients, the excipients and other things that are in there, the America's leading vitamin recommended #1 by doctors has 47 other ingredients holding it together. You really want to look at those other ingredients. But we can easily increase insulin sensitivity, decrease glucose utilization, reduce the beta cell destruction, increase impaired insulin secretion, all of these things that you're currently using in your clinic. And this is a great way to show your clients how you're going to affect their blood sugar. But you've got to get them moving. You've got to get them calm the mind. You have to work on a personalized nutrition, and it takes the entire program, not just one piece of it. It's not about substituting a medication for a supplement. It's much more complicated, but it also makes it easy. It's a lifestyle, and you're the leader. Be the leader in the lifestyle that you're trying to emulate. Well, we talked about, detoxification, environmental factors, pollutants. We know that I'm 61 years old. I grew up when there was lead in the gas, and a lot of us have toxins in our body. We know about pollutants and these environmental factors, but our mitochondria, which are our powerhouses of our cells, they are exquisitely sensitive to toxicity, and this is a big factor in the pathogenesis of diabetes. Really, mitochondrial dysfunction, it not only plays a role in insulin insensitivity and diabetes, it plays a role in type 3 diabetes, the early dementia. It plays a role in endothelial dysfunction. It plays a role in hormone imbalance. You have to have your mitochondria healthy. Your mitochondria, because every time you breathe and eat, you're nourishing your cells, but you also create free radicals. These are little bursts of oxygen, free radicals that develop cellular stress, and you need a technique to balance that cellular stress. Omega-3s, we know that those help. Those are our best inflammatories, but again, quality is the key. You've got to use good omega-3s. There seemed like an epidemic of hair loss in women with post-COVID, and a lot of other illnesses, a lot of other stressful issues, a lot of hormone imbalance. Biotin of the right kind, it's very safe, and it can make a big difference. Vitamin C, there's a bunch of different Cs, liposomal, powdered, tablet. I like vitamin C in a fruit, but vitamin C has many, many different benefits, and it goes back to we figured out what scurvy was finally by looking at the first nutrient deficiency. Zinc is interesting. When I was in Phoenix in the ICU in 2002, we found that zinc lozenges actually reduced COVID transmission, or we thought it did, and it seemed like it does. So I like zinc as a lozenge rather than a capsule. We know zinc In addition, 30 milligrams or more may lead to copper deficiency. So be careful. Every one of your supplements has an ideal dose, and zinc should be 30 milligrams or less. Selenium, particularly for your thyroid patients, can be a game changer. And then antioxidants. And this is where we get caught up in medicine. You know, the first antioxidant study was on beta carotene. And what did it show? An increased rate of death in the patients using beta carotene if they were smokers. There was no conclusion if they weren't smokers. So all we can say is if you smoke, don't take beta carotene. Well, that doesn't really help us. And you know, a lot of these clinical trials that are longitudinal, looking at something like an antioxidant, are going to be very difficult to bring conclusions to, because a single antioxidant in a 10-year case study, observational type trial is going to be very difficult to show a good outcome either way. So I think, you know, I tell my clients, I believe in evidence-based medicine, but in this room, it's N of 1. It's you. So I show them the thyroid range. My current lab uses 0.4 to 5.0. When the TSH is high, your thyroid's low functioning. Well, the American College of Clinical Endocrinologists lowered that number to 3 7 years ago. Why does our lab use 5? So how many millions of women are actually hypothyroid and are miserable or overweight, maybe on antidepressants, when really what they need is their thyroid balanced? And if we get their gut healthy, we get them calming the mind, we do targeted supplementation, and then we test them with the new guidelines. So my message to you is share this with your clients. You're not treating everybody, but you are using evidence-based medicine, but you don't treat them the same. You personalize it. And this whole concept of longevity that's hot right now and personalized medicine, this is what your clients are wanting to hear. A doctor that understands them and meets them where they are and helps personalize their care. So I use the Grand Canyon analogy. That big TSH lab range, it's like being on the south rim of the Grand Canyon or the north rim of the Grand Canyon. You're still technically in the Grand Canyon, but isn't your view different? As your personalized physician, I want to help you find where your view is the best. That's really what personalized medicine is. And to help figure out these complicated systems known as the human body, tell them we're going to start getting the gut healthy. Then the thyroid and adrenal, they're brothers and sisters that talk to each other in a way we barely understand. And then the hormones have to be optimized and balanced and able to detoxify. So the beautiful symphony known as your client is thyroid, adrenal, hormone, gut. Fix the gut first, targeted supplements, optimal nutrition. You'll be surprised how far that gets. And if your clients hear you talk to them like that, they're going to be all in on being part of your care. Chromium, vanadium, there's good data on that helps with some people, is my experience. Vitamin D is another one of those Grand Canyon labs. My lab's range is 30 to 100. Someone came from the Mayo Clinic with a blood test of 32 and told they were good and they had MS. Well, here's my thought. I think your vitamin D should be 60 to 80. Vitamin D may be the most important thing in that class. It's not a vitamin, right? It's a steroid hormone. And let's get those levels to 60 to 80. And vitamin D is not about the sun. The sun starts it, the gut converts it, the kidney activates it. It's very complicated. And again, it's a steroid hormone. Magnesium, well, which flavor to use? Glycinate, oxide, citrate, 3-and-8. 3-and-8 is the one that crosses the blood-brain barrier. Great for migraines, great for nervous system disorders. Lipoic acid, some good studies of peripheral neuropathy. You combine that with magnesium and vitamin D, you might get somewhere with it. Then there's the magic Mitochondrial, 10 to 20 milligrams. I take it every day. 20 milligrams is the dose that I tend to like because I see people focused on performance. They're personalized medicine. They're looking at optimizing their health. They're athletes. They're people that are looking to get to that top 5%. And we're going to talk about this unique molecule, this mitochondrial targeted supplement. It's really a unique mitochondrial antioxidant that's unique in the natural supplement world. So let's digress a little bit. This is old data, but look at these death rates. And isn't it interesting how that dark red follows the Mississippi River? And this is something Joe Pizzorno, the toxicity expert, pointed out to me. You'll see a lot of toxicity, a lot of heart disease, a lot of diabetes in the areas that are the most toxic groundwater, toxic ground source. So this is an epidemic. You can see Wyoming in the square there, the nice light color. That's all doing to me because I'm keeping everybody healthy. Just kidding. You know, we're all doing our part, and it's a team effort. Doesn't matter what your training is, as long as you're willing to work together for your client's best interest, we're going to have good outcomes. And it's going to take all of us for heart disease, for dementia, for diabetes. Here's your secret weapon. You can take your patient on a fantastic voyage inside their arteries. What were we told in med school? The largest organ in the body is the skin, right? Wrong. Your largest organ in your body is the endothelial lining of your arterial system. And that's what we're looking at here. Now, I was taught in med school that your heart artery fills up with plaque and it plugs it up like a plumbing problem, and then you have a heart attack. That's not what happens. So if you look at this diagram, you can see the little volcano. I call it, look, it looks like a zit popping. And when that zit pops, those are the foam cells and all the inflammatory cholesterol pouring into the artery. It activates your clotting system with the platelets. They all rush in to fix that little pop zit. They overreact, clot up, block the artery, then you have a heart attack. So you can have a 90% plaque that's marbleized and hard and safe, or you can have a 30% plaque that's inflamed with a thin endothelial cap that's a vulnerable plaque. So we can now do testing, the MPO plaque 2, myeloperoxidase, and PLA2. These are our new inflammatory molecule markers. And what do we know about myeloperoxidase? It's one of the early markers of possible plaque rupture risk in heart disease for heart attack. It's also maybe the first blood marker we're seeing in early dementia. Because again, to me, these are inflammatory diseases. These are endothelial dysfunctions. These are inflammatory processes that are very similar in cause, in etiology, and in prevention. So take your patients on the fantastic voyage. You see the HSCRP? That's the inflammatory marker we've been using for probably 15 years. And what's the best cholesterol drug study? Probably the Jupiter trial showing a change in cholesterol and inflammation. Could it be that the cholesterol drugs, the change in cholesterol doesn't make that much of a difference, but it changes the inflammation, and that's what really makes a difference. I think that's yet to be seen, but in my clinic, we address all of it. Your cholesterol, we optimize good HDL, we try to reduce bad LDL. LDL was 130, then it was 100, then it was 80, then 70. Now they're talking about getting the LDL to 60. So let's tackle heart disease first. Number one cause of death in all your patients is what? Heart disease. What's number two? It's lung cancer, smoking, non-smoking. There's some rumor that the third leading cause of death is medical errors, and I don't want to admit that. Might be true in some areas. But all the other cancers are way down. It's heart disease, and let's prevent it. So let me help you develop the trifecta to prevent heart disease, heart attack in your clinic. It's the right blood test. You cannot trust the 1975 Framingham study data for total cholesterol divided by the good HDL and come up with a ratio to predict your patient's risk. That is so 1975 patient population medication decisions. We're going to personalize it. Let's look at these advanced markers. Let's look at their inflammation. Let's look at their insulin resistance, and let's do the right blood test. The second test that I really like is a coronary calcium score. It's a low dose CT scan, so it's minimal radiation, done everywhere in the country. It's usually self-pay about $200 if insurance doesn't cover it, but it looks at that calcium. They just published a meta-analysis. See, I do like data and studies. 30 years of data on a calcium score shows if age 50 or over for both men or women, your calcium score is 0 in the 4 major arteries of the heart, you can delay any type of therapy for cholesterol for 5 years minimum. So again, do the right blood test, find those hidden people, those hidden plaque ruptures and vulnerable plaques. Number 2, do the calcium score to help either give them reassurance with a score of 0, prevent them, help them avoid a medication they don't need. but also it scans the lungs to find the heart. And if there's a lung disease or early cancer, you'll see that as well and get a heads up. It's all about early detection. We don't have great tools, but this is something, if you built your entire practice around inflammation and preventing heart disease, you'll be successful. Because guess what? You're reducing diabetes and you're reducing dementia. It's all the same process. Back in 2008, both Business Week and Time actually had cover articles on statin drugs. And the real question is, do they do any good? Well, last year, the Journal of the American Medical Society, Medical Association, also published 2 articles. It said primary prevention for statin drugs. The data is huge, the benefit is small, and time to rethink it. So primary prevention, which means if you've not had a heart attack, will a drug prevent it? The data is not very good, particularly for women. Now, if you've had a heart attack, it looks like the data getting that LDL to 60 to 70 is beneficial. So again, I'm not anti-drug, I'm pro-patient. What do we know about diabetes and cholesterol drugs? The current data says it's 8.9% risk of diabetes from taking a cholesterol statin drug. 8.9%. But we think that we're saving them from a heart attack, so it's okay to give them diabetes. I think, again, our ideas are misbalanced. Well, what do we know about the cardiovascular system? It's a high energy system, huge energy demand. So we know that the mitochondria are the key. I call them the factory powerhouses. It's what takes food and makes energy for you. I think the average 150-pound man has 10.5 pounds of mitochondria in him. So they're ubiquitous, they're everywhere. Your brain, your heart, those are the most energy demand tissues. And oxidative stress, endothelial dysfunction, inflammation, plaque rupture, these are all the same. They're all the same plan, the same basis. Everybody's talking about mTOR and caveolin and calnexin, PACS2, all of these molecular, and you can get deep in the weeds now. When I did my master's in immunology, we had 2 cytokines. I think there's 35 of them now. The amount of information that's out there. My daughter's a first-year medical student, and it is amazing to me at the level. She just finished her immunology section. The level that they're doing is just impressive. So the amount of data that's out there, you can really start looking at these. And my experience doing it is these systems, they're obvious, they're evidence-based, they work, and you can adjust their outcome. So it's like a ripple effect with this. And we know that there's at least 300 health conditions have mitochondrial dysfunction. I kind of think anything walks in my office, chronic fatigue, arthritis, heart disease, early dementia, diabetes, skin conditions, gut conditions, doesn't really matter. I'm going to be thinking about their mitochondria and what can I do to optimize it. After age about 25 or 30, your mitochondria are in a slow decline. And again, what did we learn in med school? Let's get our patients to age 50, then help them get to the nursing home by age 80. That's not what my patients want to hear. They want me to help them every year to get to their best. Then we arm wrestle together to keep them there every year to their last days. It's not about living to 100. It's about skiing and hiking and playing with your grandkids at 80. It's about functional status. And that's what this whole concept of longevity really is. It's not who can live the longest, it's who can live the best. And how do you live with function and not dysfunction? So with age, your mitochondrial get this age-related dysfunction, and it causes suboptimal energy production, which causes suboptimal function, which really is the core basis for most disease. Epigenetics, everybody comes in and goes, well, my dad had a heart attack, my brother had a heart attack, my uncles had a heart attack, my grandfather did. That's a real family history. But if someone said my grandfather was a smoker and didn't eat well and didn't take care of himself and had a heart attack at 82, I'm worried about a heart attack. I teach them about epigenetics. So Jeff Bland talks about it in a beautiful way that your genes are like a gun. The genes load the gun, your choices pull the trigger. And that's really what epigenetics means, is you have the choice. in your lifestyle habits to turn on bad genes or turn off bad genes, and also to turn on your good genes. Dean Ornish proved this in his program. He did the same heart disease program for prostate cancer patients and showed the good genes were turned on, the bad genes were turned off in things like mTOR and these inflammatory mediators at the cell level. So epigenetics is just about, you got choices in your fork and your feet about what's going to happen to you. And that's why lifestyle medicine delivered in a personal way is the future of medicine. And people love to hear this. They're not doomed to be their parents. They have the ability to change their outcome. What about the beating heart? ATP, that's the energy currency, right? That's the money of the mitochondria. You need it. That's why you eat and that's why you breathe, is to build exchange ATP and ADP and to build your energy. Your heart's only 0.5% of your weight, but uses 8% of your ATP. Your brain is also only 5% of your weight. It's 5% of your weight, but it uses 25% of your glucose. So we also know the heart, it only has enough energy for a couple heartbeats. The ATP is very short-lived. It's not a high concentration, but you need it to be efficient. And really that's what we're going to talk about today, is we have a tool to help you and your clients get the mitochondria to be more efficient. The heart has the highest concentration, the brain is second. And 90% of that cellular ATP, it's really related to the contraction and relaxation. Both of them take energy, and you need them to work in synergy. We talk about ejection fraction for people's hearts, and I mentioned the trifecta, the right blood test, the calcium score. What do we know about stress tests? That's the third part of the trifecta. A stress test is not a great test. Many people are only taking to 85% of their max because that's what some of the guidelines say. And the cardiology team breaks for lunch and they go out and they run at 100% and develop a heart attack. When I was doing hospital medicine, I saw a lot of people pass their stress test on Friday and have a heart attack in the OR on Monday. So I recommend a stress echo. It seems like a stress thallium, or the nuclear stress test, may be a little more sensitive for men, particularly big men, obese men, or men with possible high calcium scores. But the stress echo is pretty hard to beat. And I tell all my patients, and in my orders it says, take patient as close to 100% of their max as possible. Because if you go to 100% in the cardiology lab, then you can go skiing or hiking or biking or swimming at 100% and be safe. And a stress echo for women, because women, their heart is not the same as a man. Their anatomy is different. They present differently. How does a woman have a heart attack? It's not always the elephant sitting on the chest, going down the left arm and into the neck. It could be heartburn. One of my patients was brought to the ER with abdominal pain and taken for gallbladder surgery, and it turned out she was having a heart attack. So men and women are not the same, but their mitochondria is the key to keeping them healthy. Well, we know that CoQ10 was used as a therapeutic measurement in heart failure, but it's really the mitochondrial function. So heart failure is a bad term. It just means that ejection fraction is not optimal. And it's not 100%. The ejection fraction goes to 60 or 65%. And that confuses a lot of people. But when you have a decreased squeeze of the heart or lower ejection fraction, your fluid builds up, and we call that heart failure. And it directly is related to mitochondrial dysfunction. Well, here comes MitoQ. Now, we know that most things in New Zealand are cleaner than most things in the States, but at the University of Otago, they developed this unique way to target the mitochondria with a unique type of antioxidant. And it really causes this free radical quenching in the mitochondria. It was called mitoquinol mesylate. It's the main molecule in MitoQ. It's really a unique mitochondrial antioxidant. There's nothing else like it. And when I first saw it and saw the research done on it, I was immediately attracted to it. And it penetrates and accumulates inside the mitochondria hundreds of times more effectively than regular antioxidants. And you really can find the data that we're going to look at of how you see the concentration increase. Why does it? Well, typical antioxidants, and we'll use CoQ10 as an example, it's a very big molecule. So what they did with MitoQ is they made it small. Then they put on this triphenylphosphonium fancy added ion to make it positively charged. And what happens is it gets pulled into the mitochondria through the membrane. Whereas most supplements don't cross the mitochondrial membrane, the MitoQ is designed specifically to go into it much more efficiently, and it actually gets pulled into that mitochondria with a negatively charged intermitochondrial wall. So it was a genius maneuver they did, and it's really this positive charge and smaller molecule while containing the active constituent to be really the world's first unique mitochondrial antioxidant. Really most oral supplements haven't been studied for do they get to where they need to be. MitoQ has been. 19 clinical studies, 30 more in progress, $60 million of research, 750 peer-reviewed papers. And again, I saw this and this immediately attracted me to investigating it, looking at it, and taking it. MitoQ, again, is selected for an independent research in the University of Colorado. Let's look at some of that data. Well, free radical biology, my mentor was Denham Harmon. He's the father of the free radical. He should be getting a Nobel Prize. But we would find each other in the stacks of the libraries, arm wrestling over the latest journal on oxidative stress. But we know that MitoQ has been proven to increase mitochondrial dysfunction in heart failure. So there's clinical trials, there's bench science trials, there's athlete trials, there's elderly trials. It's been assessed in all parts of your client base. What does it do? Clinically proven to reduce free radicals in the mitochondria, improve arterial elasticity and aging of those arterioles, increase your natural antioxidants. It reduces biomarkers of oxidative stress. We see this in our clinic. The fantastic voyage I took you on, I take everybody on that, and we see it reducing. We see clinical benefit, and we see laboratory biomarker benefit. We know it reduces DNA damage after exercise. We're going to look at some of that data, and it really protects your membrane integrity of your mitochondria. Well, wouldn't you like to improve the dilation of blood vessels in your patients? Wouldn't you love to boost their natural antioxidants? How about reducing their oxidative stress? There's the studies there to prove it, and you can show 42%, 36%. These are not minute benefits. These are significant benefits in the things that benefit your clients the most. The brachial artery flow, we're going to show you how they do that. That's really one of the best ways to measure our endothelial function in a clinical setting, but it's really being in love with your endothelium and your mitochondria. If you get those two things right, you're going so far for your patient's health and preventative health. That's really the key is. So this brachial artery flow, what do? They put on a blood pressure cuff. You get ischemia below the cuff in the hand, and you can see it there. The brachial artery, they measure with the sonogram, and they can see this change in blood flow with brachial artery flow mediated dilation. That's the gold standard. There was an integrative cardiology conference in Hawaii 20 years ago I went to. You'd have loved it. They had Andrew Weil and Dean Ornish arguing on what was the best diet. And I got up and said, I don't think there is a best diet. I think it's personalized nutrition. And everybody laughed at me. So I think this is the key is let's do good data and let's use the techniques that are proven. And this is the most powerful one that's out there. And showing that mediated dilation, whether it's an acute dose or chronic dose, you don't need the acute huge dose when you're taking MitoQ regularly. Showing the benefit of consistent dosing on patients with the gold standard test. Dr. Rossman out of University of Colorado really doing some fantastic research in endothelial function, in heart health, looking at the femoral post-wave velocity. Again, oxidized LDL, that was in our fantastic voyage diagram. Wouldn't you love a tool that's going to reduce it clinically for your patients? You have it. It's called MitoQ. 6-week study, 178 people looking at the benefit. Mitochondrial damage. We know that you have mitochondrial damage every time you eat, every time you breathe, every time you exercise. And you can decrease that with MitoQ by protecting that mitochondrial antioxidant stress. So really it's this unique antioxidant that targets the mitochondria uniquely over anything else. It's what we're really trying to do to get this benefit. and looking at DNA damage in the mitochondria, we can see that you have the benefit with MitoQ. What about cyclists? How about improving times in the 8-kilometer time trial? I mean, this is the difference between first and 10th is just a little bit. And if you can get that edge for your athletes, you're getting it for your patients. You want to win over one of your next clients? Tell them you're going to treat them like an athlete. And if they were an athlete sitting in front of you, would you make more personalized, better decisions? Absolutely you would. So again, increasing average power output. Who doesn't want that? This is what your clients are looking for. They're all athletes. Let's treat them like athletes. Even the 80-year-old woman who walks every day, we want her to think about her body as an athlete. So she feeds it good nutrition. She puts in high octane food and she supplements what she needs to help. Isoprostanes, this is part of your endothelial dysfunction. Again, you can decrease them directly with MitoQ. Supplementation to augment the acute exercise injuries. PGC1 alpha is a real measurement of gene expression in the mitochondria for mitochondrial biogenesis. We know that there's a real benefit at the mitochondrial level, not just for protecting it, not just for an antioxidant benefit, but also for increasing your biogenesis of your mitochondria. It's possible to shift that. MitoQ does it. Clinical trials proven. Again, I'm in love with the endothelium. I think that's what I teach all my patients. It's not the skin, the largest organ, it's this endothelium. Same in your heart, same in your brain. You want to do the combined training, and that's really what works together. So looking at these additional levels of antioxidants, nitric oxide, and in hypertensive patients as well. So peripheral artery disease. What tools do you have to help someone with peripheral artery disease? Not much. There's a drug that doesn't work very well for it, but you don't really have much. You can't eat your way out of peripheral artery disease. And if you had a tool that would help improve their endothelial function and their exercise tolerance, these are people who can walk 100 feet and that's it. If you can get them to walk a quarter mile, you've done a game changer for them. So this is the key about falling in love with that endothelium and using MitoQ for these esoteric different conditions. MS, COPD, we don't have great tools for those type of diseases. Peripheral artery disease, you just don't have great tools. So, a lot of people talk about supplements, but no one seems to know the best way to take some of them. So, what about vitamin D? Should you take it on an empty stomach? No, you should take it with some fat because vitamin D is fat soluble. Can you get toxic if you take too much? Of course you can, because vitamin D is fat soluble. It will get absorbed, where some of the B vitamins you can't really get toxic in because they're water soluble. B12, pretty hard to hurt yourself with B12. B6, what's the toxicity of B6? Peripheral neuropathy. I see probably one a month. Somebody's on super high doses of B complex, they get a B6 toxicity. No one thought about it when they went to the neurologist and got checked for neuropathy, for peripheral neuropathy. So here's how I take my MitoQ. I kind of almost make it a little ritual in the morning. There are some things that are just better on an empty stomach first thing. And so I take a few moments of gratitude in the morning. I take my MitoQ with a glass of water, and I have a big pint glass. It's the Wyoming Bucking Bronc that sits by my sink. And I fill it up every morning with water. I get a MitoQ. I sit down in my comfy chair. I think about something that happened the day before that I'm grateful for. Usually there's a conversation or an interaction or something you saw that helped you feel good. Put it in your memory bank to think about the next morning. Have that moment of intention, have that moment of gratitude, take your MitoQ. It's best on an empty stomach. It's water soluble, so it's best to be taken with a little bit of food for absorption. I'm sorry, take it without food for absorption. So there's a MitoQ Pure. This is the straight, it's 5 milligram, 10 or 20. Practitioner doses are 20 or 10. If you're looking for a clinical indication, you're never wrong to use the 20, but the 10 does work for most people as well. Curcumin. There's a long Vita subtype of curcumin that's out there. It is by far the best type of it. And this is what you want to see. You want to see a good supplement company link it up with the best quality of their additive. In curcumin, skin health, cholesterol levels, heart health, brain health, metabolic function, clinically proven for tension, hostility, mood disorder, fatigue. The long Vita curcumin is the one to use. And I've seen it work well in anxiety, and there's clinical data to show it. So when you can combine things, you can have a 1+1. It can be a synergy, and you get a 1+1 = 10. What I found really helpful is kind of a heart program, and I like MitoQ. I like the carnitine, magnesium, vitamin D, and I'll add a little bit of powdered ribose sometimes as a second thing to have with their breakfast. So ribose, carnitine, magnesium, D, MitoQ. If you have someone who's had a statin myopathy or damage to their muscles from statins, or people with muscular issues, MS, other muscle damage or other muscle weakness, they're just coming out of a surgery or coming off of an injury, trying to restore that muscle health, this is a great cocktail. It helps the heart muscle, but also helps your entire cardiovascular system. Clinic Boost, these are my friends. Give Clayton a contact. He's great. This whole team. I only work with good people, and I refer good people. And I appreciate you taking the time to be on our webinar today. This is my mission in life, is to help people be better in their health. And I've personally taken on myself to help the practitioners be better. If we can help you as a team be better as a practitioner, anything that I have, you are welcome to. Reach out to the Clinic Boost team. They can connect to me. I'm happy to help you be successful. Remember, it's a team approach. We're all working together to help people get healthy. So I'd like to introduce Nicole Barnett from Mitoq to help us answer a few questions. So maybe while we're waiting for her, one of the big questions I get asked a lot.
Hi, Mark. How are you doing?
Really, where do you get this information, and where do you help share it with? And one thing that's worked in our clinic is to develop programs. We have a mitochondrial program, an energy program, a gut healing program, a sleep program. You can see what we use and borrow the same thing. The guys at Clinic Boost have these programs available, but develop a program around these conditions so you have a handout to give them about how to eat, how they should exercise, the supplement program they should use. Be a guiding light, make a little video for them you can share, but try to put just a program together that ties all this together. You're welcome to borrow the information we're sharing with you, but having a program for people, you'll get more buy-in, you'll get more compliance, and you'll get better outcomes. So that's one of the things that's really, really worked well for us.
So, Mark, I have a question for you, if that's okay.
Please.
When you look at treating cardiovascular disease and pre-diabetes in your clinic, at what stage do you start introducing supplementation, and what do you do with that supplementation in adjunction to lifestyle changes as well?
That's a great question. Timing's everything, right, Nicole? I think as I've gotten older and hopefully wiser and more patient contact, I'm starting things earlier. Now, you really have to read your client. Some people, they just want everything at once and just get started and jump off the cliff. Other people need a little hand-holding, and you need a gentle nudge. And that's kind of where the program comes in, is, let food be your medicine. Always start there. Have them keep a food log for a week, see what they're eating. And our food log has your energy level, your sleep quality, your sleep hours, some of the other lifestyle measures. It takes them 2 minutes to fill out every day, but we can look back and we can see what their week was like. So I think, some of the core nutrients, and it comes down to what condition you're treating. The longer I've been working with product, working with Mitoq as a product, it's become one of my cores, because I find every condition I see, mitochondrial dysfunction is at the core of it. And, I just want to check that box as we go. I've never seen anyone not do well with it. I've never seen dysfunctional clinical outcome. People don't get upset stomachs. They don't get diarrhea from it. I don't see these kind of side effects. So it's kind of one of my starters. Most of my patients will do initial labs, and typically we'll look initially to get the groundwork fixed before we do the heavy lifting. So I won't usually do advanced cardiovascular panels until we've already got some of the gut inflammation taken care of, gotten the mitochondrial support with MitoQ, get some of the other inflammatory things out of their diet, and then we'll do some of the advanced testing. And I find that you get a lot better information when you clean house a little bit. And people like that model. You know, there's also something about a program that if you have people in, say, a 90-day program, they know they're going to be retested, their compliance is just plain better. If they know they're coming back to get checked on by the doctor or get retested, they will have better compliance. And anything you can do to increase compliance is a key.
And when you look at supplementation for the purpose of longevity and extending your health span, rather, what do you recommend in that regard?
Well, again, I start with food as medicine. Personally, I take an omega-3. I start with MitoQ in my morning of intention. I do 2 big glasses from that pint glass of water I mentioned. You know, it's a ½ ounce of water per pound of body weight. I'm 200 pounds. I need 100 ounces of water a day, probably more. So, you know, one is getting my water first thing in the morning. I take my MitoQ. I also take an omega-3, a vitamin D, and a good high quality multi. And we're actually using a core pack where the MitoQ is separate because you take it on an empty stomach first thing with your morning gratitude or intention, or just I like to wait 20 to 30 minutes before I eat after MitoQ. And then again, it's an omega, a multi, and a D. That's my morning go-to. And if I've had a big ski day, I'll take a couple extra omegas that day. I find my body responds. And again, vitamin D, I test every patient, immediately try to get them to the 60 to 80 range.
Great, thank you. Do we have any more questions coming through?
Well, thank you, Nicole, and thank you, Clinic Boost and MitoQ. And for those that are listening or in the future, you've got Clayton's email. He would love you to bother him. So if you have further questions, you can shoot him. He's in contact with me, and I'm happy to help in any way. And again, thank you, Clinic Boost. Thank you, MitoQ. And thank you for joining us. And I wish everyone a happy, healthy day.